All right, in health news this morning, if you suffer from varicose veins, know that you are not alone. Varicose veins and venous dysfunction affect 25% of the population, and it's important to know the causes and symptoms of varicose veins and what potential treatment options are available to you. Joining me from Mercy Health is vascular surgeon Dr. John Morris. Good morning. Thanks so much for being here.
Thanks for having me.
Yeah, let's talk out by starting about those symptoms.
Yeah, for sure, for sure. The symptoms can be very wide-ranging depending on kind of the severity. They can be simply itching or cramping, which are kind of mild, and people don't think that veins can cause those, but they certainly can. In addition, swelling, discomfort. When the veins get more severe, can develop some skin changes and actually even ulceration and chronic wounds.
Oh, goodness.
Yeah, get pretty bad.
Okay, so we have the difference that we need to know between varicose veins and then spider veins.
Absolutely. Those varicose veins are those big bulging veins. When you stand up, they bulge out of the skin, and they're actually under the skin. And those spider veins are those tiny little purple things. They're within the dermis of the skin, more commonly affecting females.
Okay. What causes varicose veins?
The varicose veins are caused mostly by valvular dysfunction in the lower extremities. Now, what does that mean? We have one-way check valves. In a ladder-like fashion, blood comes up out of the leg against gravity. These valves try to promote circulation back to the heart. However, if the valves don't work, then blood is able to pool back down into the legs. And when it does that, it causes high pressure in the veins. The veins get larger, and it subsequently develops symptoms.
Sure. And I know people are always worried about the way that they look and stuff like that, but you need to know if there's more serious problems. So what kind of testing can be done? Yeah,
absolutely. Well, just visual testing, first of all. We can just do a visual examination. And then we do an ultrasound in the office. We can't necessarily see all the veins that are causing the problem in the leg with just a visual examination. So we do an ultrasound and look and see how the blood is moving through the legs to see if the valves are working, and based on those results, we can make recommendations for treatment.
Yeah, and many people are watching right now saying, you can really treat this? What does that entail?
Absolutely, and it's very minimally invasive. We can do our procedures typically in less than 1 hour. Even the most severe case of varicose veins is an office-based treatment under local anesthesia. In the office, you're awake, and after the procedure, simply walk out of the office and can do most of your normal activities. There are really 3 different procedures. One is a heat energy called radiofrequency ablation, and that is a treatment from inside of the vein, and it uses heat energy to kind of close the vein down from the inside. In addition, we can make very tiny little incisions, and we can pull the veins out through the skin, called microphlebectomy. And then for those little pesky spider veins, do injections with a medication called sclerotherapy to get rid of those.
If this is ignored and I let these go on, what kind of dangers lie out there?
Yeah, so mostly it's a comfort issue for most people, but if you let it go for a long time, you get those skin changes. You can develop ulcerations or wounds, which can be very complicated to treat. You can develop some blood clots in the veins under your legs. So yeah, if a lot of people don't realize that it's a relatively quick and easy treatment. They can tolerate very well.
And you said it's more common for women, but I mean, I've definitely seen men that suffer with this too.
Completely, yes, yes. Treat a lot of men with varicose veins as well. Men or women that have jobs where they stand for long hours during the day. Nurses, people that work in factories are definitely prone to having issues with varicose veins.
Okay, well, it's worth getting checked out. I mean, short season is here, right? At least for a couple of months.
Yeah,
All right, to schedule a consultation, visit mercyhealthveincare.com or call 616-685-7850. Thanks so much for stopping by.
Thank you.